Good morning to one and all. Today's lecture topic is principles of tooth preparation. And I'm Dr. Priyanka. Okay, coming to the learning outcomes. I have clubbed up the part one and part two learning outcomes together. So, discuss the methods of conservation of tooth structure, factors that contribute to retention and resistance of the crown, describe the various finish line configuration, how do we increase the structural durability of a crown, advantages of a supragingival margin, indication of subgingival margin, and various methods to preserve the tooth from being prepared and protect its surrounding tissues. Okay, coming to the fundamentals of tooth preparation. There are two standard textbooks, which are Rosenstiel and Schillenberg that you always hear. According to them, fundamentals of tooth preparation is to achieve optimal restoration success. So Rosenstiel has divided it into the biologic, mechanical, and aesthetic. Yeah, the Venn diagram. And Schillenberg has divided it into preservation of tooth structure, retention, and resistance, structure, durability, marginal integrity, preservation of periodontium, right? So, firstly, biologic, mechanical, and aesthetic. So, in biologic, you basically conserve the tooth structure, you avoid over contouring, you do try to place supragingival margin, you have harmonious occlusion, you protect tooth against fracture, and the mechanical form is retention form, resistance form, and deformation. Okay, coming to the third one is the aesthetic. So it has minimal display of metal. There is less maximum thickness of porcelain. Porcelain should have an occlusal surface, and there should be subgingival margin where it is indicated, guys. Okay, when you um use all the three principles properly, you'll have an optimum restoration. Okay. Okay, guys. So this is according to Schillenberg now. Principles of tooth preparation. So preservation of tooth structure, retention resistance, structural durability, marginal integrity, and preservation of the periodontium. All right. So I'll be going through step by step in each. Okay. So first of all, methods of conservation of tooth structure. There are various methods for the tooth that is being prepared. So, tooth structure is conserved through adherence to the following guidelines: use of a partial coverage rather than a complete coverage restoration. Ideally, is advisable, guys. Yes, here we do a full coverage crown because of various reasons. But yes, if you do want to conserve, that's why there are various designs that we did cover in the introduction portion, right? Okay. Preparation of teeth with maximum practical convergence, that is the angle of taper between the axial walls, right? So there has to be taper present in the preparation, right, between the axial walls, so you can have a conservation of the other rest of the tooth structure. Okay. Preparation of occlusal surface so that the reduction follows the anatomical plane to give uniform thickness in the restoration, right? So the preparation of the occlusal surface um, has to be uniform, guys, okay? And it has to be in an anatomical plane. Preservation of the axial wall so that the maximum thickness of the residual tooth structure surrounding pulpal tissue is retained. So the axial wall should be prepared, but there has to be some maximum thickness, which should be there of the remainder of the teeth, guys, okay? Selection of margin geometry that is conservative yet compatible. So we will look at the margin designs and all, and then we'll talk about it. Avoidance of any unnecessary apical extensions of the preparation. So do not do any apical preparation or any subgingival margin indicated. Okay. All right. Okay. So now coming to the retention and the resistance form guide. So first of all, the retention means the ability to prevent the removal of restoration along the long axis of the tooth preparation. Okay, so that is resistance, right? Or that, sorry, that is retention. Okay. Um, on the other hand, the resistance form is prevention of dislodgement or restoration by forces which is in the apical or in the oblique directions. Okay, like stated in this photograph. All right. Okay. So geometrical configuration of tooth preparation has to be proper, guys. It has to be according to the anatomy of the teeth. Retention, or we have just discussed the definitions. Both of them are interrelated and they do share qualities, right? Inseparable qualities, guys. Okay. So coming to retention, the essential element of retention is two opposing vertical surfaces of the same preparation, right? So how we prepare both of them consists of a retention form. These may be external surfaces such as the buccal and the lingual walls of full veneer, like the sleeve preparation. So any two surface of the crown will give you the proper retention form if prepared well. The opposing surfaces can also be internal, such as the buccal, lingual, and the walls of a proximal box of an inlay. Okay, so something like that. This one and this one, guys. Okay, yeah, yeah. Sorry. So the inlay is this one, guys. Yeah. Okay. So the box of the inlay. Yeah, these two walls will be creating a retention. Okay. So coming to retention form, there are some factors which are affecting the crown given in your curriculum, guys. So the factors are the factors that contribute to the retention of a crown. Yeah, these are some five factors. So the magnitude of dislodging forces, geometry of the tooth preparation, roughness of the fitting surface material being cemented, and film thickness. Okay, so magnitude of the uh, dislodging forces is nothing more but the taper of the preparation, guys. Okay, so a proper amount of taper has to be given so that the freedom of the movement is the freedom of displacement is not too much, guys. Okay, and the geometry of the tooth preparation, proper anatomy and proper margin has to be given, roughness of the fitting surface of the restoration. So ideally, obviously, the inside of the crown is not so smooth like the outside, right? It is roughened, and then we have a luting cement. So the luting cement will go and it will create the retention form, right? Materials being cemented, so we have to see which luting cement is being cemented, is even being used, and which material is we are using. Film thickness of the luting cement, so you have to have an adequate thickness. You cannot have excessive thickness. It's not going to serve any purpose, guys. If you have an adequate thickness, then it's going to give you a retention form. Okay, so now these are some factors for cemented restoration summarized in a table. Taper, surface area, type of restoration, type of preparation. So you just see that the greater retention is parallel, lesser retention is excessive, in the middle is 6 degrees that we are doing. Okay, so surface area large will give you more retention, small will give you no retention. We are somewhere in the middle, we are doing adequate preparation. Type of preparation, molar complete crown. Intracoronal will have the least, molar will have the most because of the surface of the preparation. Surface texture, rough will have better retention than the smooth. Film thickness varies in the cement and the luting agent. So adhesive resin is the best one. GIC and zinc oxide eugenol used as a temporary cement will have the least. Okay, all right. So occlusal gingival length, factors of retention and resistance. So this is also um, one of the factors, guys. Okay, so the greater the surface of the preparation, the longer preparation, the greater the it's the retention, so which equals to the preparation of large teeth and more retention than the small teeth, right? So it's just the table which I've just summarized. Cement creates mechanical interlocking between inner surface of the restoration and the axial walls, guys. Okay, right. Okay. um So surface area can be increased by adding boxes and grooves. The shorter the wall, the more important is its inclination. The shorter preparation, as it has a little taper as possible to increase the resistance, right? So as you can see, in a longer prep, it's kind of more difficult to dislodge. In a shorter and a wider prep, it is easier to dislodge, right? So you have to have an adequate crown prep. Okay. Retention. Yeah. So retention resistance continues, guys. So limit of path of withdrawal is known as the retention, guys. So that's what is going to retain the crown, guys. Okay, so in longer prep there are parallel axial walls and grooves which causes good retention. In over tapered it will be short and then it will be less retentive, guys. Okay, so limiting the freedom of movement, like I just told you, okay, of displacement from torquing or twisting forces in a horizontal plane is resistance, guys. Yeah. Additional internal features which boxes and groups can be given. So resistance form also has some factors which has to be taken care of, guys. Okay, that is magnitude and direction of dislodging forces, geometry of the tooth preparation, physical properties of the luting cement. Okay, so the basically the direction of forces and the margin acting, the margins which are prepared and the luting cements basically form the resistance. You can see that the factors influencing the resistance form of cement and restoration. So dislodging forces or the higher resistance are the habits, and anterior guidance has the lowest resistance. Okay, taper minimum, moderate, and excessive. Yeah. Okay. Diameter, premolar and molar, right? So the lower resistance is here, guys. Okay. Height, long, average, and short, right? So that's how we are going about. Okay. So now coming to taper, guys. So in short, what is taper is taper is the angle of convergence and the angle of divergence. Okay, it's so basically the axial wall of the preparation uh, must have taper that slightly permits the restoration to seat. So three degrees on each side we give, that is taper, guys. So we give a 6-degree taper, right? Okay. Coming to the freedom movement, so maximum retention is achieved when there is only one path. Okay, single path. Okay, right? Not too many paths, guys. All right. So it cannot, it does, so it does not have the freedom displacement. Okay, length, it has should have adequate length, guys. Substitution of internal features. So sometimes you can give some grooves and boxes just to create a V shape, boxes just to create that um, retention form, right? A path of insertion, guys. So basically the path, a path of insertion line and path of insertion is the same thing. So again, like we have discussed in this factor, it has to be single, it should not be multiple, right? So when you prep the teeth properly in regards to these factors, you will automatically get a good path of insertion, or sorry, a single path of insertion, guys. Yeah. Okay, so um more nearly parallel the opposing wall of the preparation, the greater the retention. Okay, so you do have to follow the tapered principle, guys. Okay, tooth preparation taper should be kept minimum because of its adverse effect on retention, right? So you cannot have excessive taper. If you have excessive taper, you'll have many path of removal and insertion, guys, and you will lose the retention form. All right, yeah, there. Okay. Okay. Axial walls of the preparation must be tapered slightly to permit the restoration seat, like I just discussed. Two opposing surfaces, each should have 3-degree inclination. Okay. And total is 6-degree. Okay. So this is the taper which we were talking about. So visualize the preparation wall. So we should be able to visualize it. It prevents the undercuts. Um, it compensates the fabrication inaccuracies and permits complete seating during cementing, right? Okay, so like I was talking about the path of insertions, this is, you should be able to see by the bird eye view. Yeah, dear? Yeah, guys? Okay. So coming to the structural durability, guys. All right. Okay. So, restoration must contain the bulk of the material that is adequate, and it should be able to withstand the forces of occlusion. Okay, occlusion, guys. Okay. This bulk must be confined to the space created by the tooth preparation. It should be confined, guys, right? It should not be too much over. It should cannot be excessively over. Okay, so it should be just correct. You can see that um ex adequate, excessive, and in the middle, guys. Yeah. Okay, not so sufficient and not too excessive, right? So B is correct. Only this way the occlusion will be in harmonious and axial contours will. Okay. So how we give a structure durability is by doing a proper occlusion reduction, functional cusp beveling, and axial reduction, right? Axial, functional cusp bevel, and occlusal there. Okay. So coming to the occlusal reduction, one of the most important feature of providing adequate bulk of material um, and strength to the restoration is occlusal clearance. Okay, so you have to have occlusal clearance. So these are different clearance for the different materials, right? So basically 2 mm in short. Yeah, 1.5 and 2 mm here, right? Adequate, and inadequate, guys. Okay. So the basic inclined plane pattern of the occlusal surface duplicated to produce adequate clearance without over shortening the preparation. Yeah. Uh, you cannot shorten the preparation, guys. A flat occlusal surface may over shorten the preparation. Okay. It will shorten the preparation and it will be against the laws of retention. Okay. Inadequate occlusal reduction. So makes the restoration weaker, will not provide adequate space to allow good functional morphology under the anatomical grooves. The restoration will easily perforate by finishing procedures or by wear in the mouth. Okay, so it should be adequate, guys. Yeah, inadequate creates a lot of. Okay, now functional cusp bevel is an integral part and it should be given only on the functional cusp, guys. Okay, a wide bevel placed on the functional cusp provides space for an adequate bulk of the metal in that area to bear the heavy occlusal contact. Okay, okay. Lack of functional bevel may produce several problems, guys. So you can see the surface is beveled, guys. Yeah, okay. So it can cause a thin area or perforation, uh, may result in over contouring or poor occlusion. Over inclination of the buccal surface will destroy the excessive tooth structure and reduce the retention, guys. Okay. Coming to the axial reduction, it plays an important role in securing space for an adequate thickness of the restorative material. Okay, so axial reductions has to be perfect. Yeah. Inadequate reduction will cause thin walls and it will distort and it may lead to paradox. Okay, so there are other features that serve to provide space for metal that will provide the rigidity and durability of the restoration. So there's offset, occlusal shoulder, isthmus, proximal grooves, and box. So this can be created, guys. Okay, so you can see it in the photos. Marginal integrity. So the margin of restoration must be closely adapted to the finish line of preparation, guys. Okay, so it should be close to the finish line. Yeah. Configuration of the preparation of finish line dictates the shape of restorative material in the margin of the restoration. Yeah. So it should be well defined, it should be continuous, it should be even and smooth, it should be located at an appropriate level, guys. And you should follow the gingival margin contours, okay? Break contacts, you should, and of course, should not break and of course, the contact has to be properly broken, not excessively broken with adjacent teeth, okay? And you should not destroy the adjacent teeth. Okay, coming to the finish lines, guys. So you can see that these are different type of finish lines. Chamfer, heavy chamfer, shoulder, all given in the photo. Radial shoulder, shoulder with bevel, and knife edge, right? Okay, coming to chamfer, usually given preferred gingival finish line for full veneer metal restorations. Okay. This finish line exhibits least stress to the underlying cement. It can be prepared by a torpedo or round and tapered diamond. So this is a chamfer, guys. Okay, conservative type when compared with the shoulder finish line. Okay, a shoulder recommended for all ceramic restorations, resistance to occlusal forces and minimum stress that might lead to porcelain fracture. There has to be adequate bulk of material at the margin. It should require much tooth structure destruction. 90-degree internal line angle concentrates stress coronal fracture. Okay. So margin placement usually for the supragingival, wherever you can just place the supragingival, it's easier to clean. Doesn't create trauma to the soft tissues. Okay. Other advantages include that it is not associated with the soft tissue traumas. It can be kept plaque free, and persons are more easily taken. Yeah, less potential for soft tissue damage. Restoration can be easily evaluated at the time of placement and call appointments. Okay, all right. Coming to the subgingival margin. So we're comparing two margins. Yeah. It can be justified in cases where the restoration causes cervical erosion or dental caries is subgingival. The proximal contact area extends to the gingival crest. Additional retention resistance is needed. So there are places subgingival margin is indicated. The margin of the metal ceramic crown is to be hidden behind the labiogingival crest. So in such cases also you can do it. Root sensitivity cannot be controlled by more conservative procedure. So that's why sometimes the application of a dentine bonding agent can be done and you can still place the margin subgingival. A modification of axial contour is indicated if in any cases such as to provide some undercuts, guys. Yeah. So in that case, it can be given. This is in short about the margin designs, right? These are all the margin design and advantage, disadvantage, and indications, guys. Okay. So this is from rosin steel, guys. You can see that this is feather edge, chisel edge, chamfer. This is bevel. This is shoulder, guys. Okay, this is sloped shoulder, and this is bevel shoulder, right? And then same can be seen, almost same things in the electron microscope. Yeah. Okay, guys. So thank you so much for patient listening, guys. We will do more discussion. Um, if you have any doubts, guys, I'm on level 20 in Polyclinic 3. For any further doubts, come and ask me. And the standard textbook of reference remains Schillenberg and Rosenstiel, like stated. Yeah. Thank you.